Let's begin with NBC's chief White House correspondent, Chuck Todd. Chuck, good morning to you.
Well, good morning, Meredith. Well, the president started this effort in health care just over a year ago. It was on the 44th day of his presidency. Now here we are a year later. Here we are decades when after the president and the Democratic Party made this promise. The process was messy, but we are now one signature away from it becoming law. Just before midnight, it was official.
The yeas are 220, the nays are 211. The bill is passed.
With no Republicans voting for it, Democrats passed the most expansive and ambitious effort to reshape how Americans receive and pay for health care.
At a time when the pundits said it was no longer possible, we rose above the weight of our politics.
Soon after the vote, President Obama, who admitted that he was putting his own presidency on the line with health care, basked in the glow of victory.
We didn't give in to mistrust or to cynicism or to fear. Instead, we proved that we are still a people capable of doing big things.
Following the historic vote, the Speaker of the House had an air of satisfaction.
It's great pride and great humility that we undertook this great act of patriotism.
A fiery House Republican leader, John Boehner, attempted to turn the loss into a rallying cry.
Can you say it was done openly? With transparency and accountability? Without backroom deals and stuck behind closed doors? Hidden from the people? Hell no, you can't!
The changes that will become law once the president signs both bills will be phased in over years. Some of the immediate changes include insurance companies can no longer drop patients that get sick. Providers must offer free preventative care. There can be no caps on lifetime benefits. And young adults can stay on their parents' policies until age 26. But the bulk of the changes to the system won't kick in for years, including by 2014, all Americans must have health insurance or pay a fine. Also in 2014, insurance companies will no longer be able to deny adults coverage for pre-existing conditions. The most noticeable tax increase begins in 2013. The Medicare payroll tax for individuals making more than $200,000 a year will go up nearly a percentage point, a 30% increase. It was the power of the presidency that put the Democrats over the top on Sunday afternoon, with the White House striking a deal with the last handful of Democratic holdouts who were led by Michigan Congressman Bart Stupak over the issue of abortion.
So I'm pleased to announce that we have an agreement.
The president's chief lawyer, Bob Bauer, spent most of the weekend working with Stupak on how to word a presidential executive order reaffirming Stupak's position that the bill should not allow federal money to be used for abortion procedures.
Make no doubt about it, there will be no public funds for abortion.
Later on the House floor, Stupak found himself heckled when someone shouted, "Baby killer." Now, the entire issue is not yet settled. The House passed that Senate bill, which was passed last Christmas Eve, word for word. Then they did this second bill of reconciliation laws, fixes, if you will. The Senate takes that up beginning tomorrow. They have to pass that word for word for what the House did. Of course, Senate Republicans want to try to gum up the process a little bit this week. It's going to be a long week again. But again, one part of the bill is passed, and the president himself may actually sign it as soon as tomorrow, Lester.
All right, Chuck Todd of the White House. Chuck, thanks.